If you're having trouble getting your elbow to fully extend again after an injury, here are 3 ways at Mobility Doc that we help athletes all year long to restore that range of motion. I'm Doc John from Mobility Doc, and I wanted to take a moment to show you all these 3 very specific tools that we use every single day here that you can also have at home, and you could do this yourself. You probably haven't seen these before, and maybe if you have it even, you just aren't quite sure how to use it. Watch to the end, so that way you don't miss when to do this, how often to do this, like all of the right ways and wrong ways to make sure that you get the most out of it. All right, let's get into it. I'm gonna grab, first and foremost, one of the newer things we've been working with. We're gonna embed a link, so that way if you want this bad boy, you can get it. This is the future of cupping. It is called Cupper by Achedaway. It's pretty incredible. We did a video on it recently, and it has LED, dynamic compression, and an ability to have 5 different massage functions, or really 5 different ways of how long it pulls for and how much it actually pulls in terms of suction. So if you've hurt your elbow and you're having a hard time extending, maybe you're a jiu-jitsu athlete, a powerlifter, or a weightlifter, maybe you're a runner and you fell, and this is maybe 2 weeks, 3 weeks after you've fallen. One of the most common reasons is if you've developed adhesions and built up possibly scar tissue, and you just need help breaking up those adhesions so that way the joint of your elbow can fully extend again and lock all the way. And if you don't do anything about it, sometimes you can start to lose range of motion and you just keep losing more and more. Commonly, like the bicep gets really tight and short and irritated, but also the flexors and extenders of your forearm, as well as your tricep at the back of the elbow, those get involved too. So with something like the Cupper, what you can do is I turn it on, and I'm gonna put it on the massage function, which is the 3rd mode here. Watch the video that we made so you can see more about how to use this. And then I'm gonna leave the light on for the infrared, and then I'm going to put it on a level of 3. It comes with a little lasso or lanyard, so that way you don't have to worry about it falling, but this thing really sticks. So let's say I wanted to come after my tricep, so let me move my shirt a little. I'm gonna get this guy on there, and I don't know you'll be able to see it perfectly, but this thing really grips on. And once it's gripped, it's not going anywhere. Again, I recommend keeping a hand on this or having it attached to your actual arm. What it's doing is it's like breaking up those adhesions by physically pulling at this area. And then once it's on there, what you can do is you can start adding motion to this. And that's the thing that gets missed. All 3 of these techniques are gonna have motion. So you're going to bend and extend, and you're gonna try to lock as much as you can. And you're gonna feel that, because this is doing like an active release technique, which is sometimes pretty hard to do by yourself, where you pin down an area of dysfunction and you actively move through that range of motion to further break up the adhesions in the connective tissue, in the soft tissue, the fascia, the muscle, and the layers in between that connect between the skin and muscle fibers. So you're gonna go through about 10 or so extensions of your elbow, but you could even do more depending on how fast you're moving. This is more about getting some motion in. If you have the Cupper on, you have a timer you can set, so it's usually in about 14 minutes. So some of the time what we do in our clinic is we just have someone just chill, relax, let the Cupper do its job, and then every so often, maybe every couple or few minutes, add in some motion. You can supinate and pronate at your hand and wrist, and then you can also extend and flex at the elbow. And again, sprinkling it in while the Cupper's on. If you have a regular cup, you can certainly do the same thing. The only thing it won't be able to do is add this dynamic suction component that it has, where it's quite literally changing and varying pressure, which I think is what makes this truly superior. But I'm gonna show you 2 more ways. So if you don't have the Cupper, you can also do the following. I'm gonna turn this off real quick. Once you have it off, you'll see pretty quickly, I'm gonna pull this that thing, not in a whole lot of time, already starts to leave a mark. So, you know, make sure you don't crank it up all the way. Keep it at like a level 2 or 3 of suction, and give it like 10 minutes, see how you do. Let's put this down, let's grab the next. So you're having trouble extending. Like I said, maybe you had a hyperextension injury. Rock floss, or muscle floss really. Muscle floss is a great way to break up adhesions as well. This band is offered by a bunch of different companies. We'll provide some links to that too. The hardest part with using muscle floss is sometimes just getting it on. And if you're by yourself, it can be quite difficult. I'm going to try to record this while I'm doing it with you and I don't have any help. So this will be a good opportunity for you to see how I do it, and I might struggle a bit through it. But basically you want to lay the floss band down and cover the elbow. We're going to put a video in here so that way you can see how to use muscle floss, because we really did an exhaustive tutorial on how you could do this in different parts. But because remember, you're trying to fix extension and flexion, pronation and supination. With this band on, you're going to go through those motions. So I'm going to lay it down, and I'm going to do my best without having any advantage here to put my hand on anything to anchor this. And I'm going to lay it just gradually, and if I am worth my weight at all, I'll be able to get this to stick. So now it's starting to stick. Once I have enough of a foundation there, I can start to pull through and cover the muscle, cover this real estate with the band. And you could go below the elbow, and you can also certainly come above. You should most certainly, at least at the very least, alternate above and below. Because again, I'm by myself, I'm not even gonna bother trying to actually like fold the band under. I'm just gonna hold it, right? So now that I have it on, you can see I got like old man arm now. It's all wrinkly and squished. You're gonna go through flexion and extension. You should feel like this is actively breaking up like the adhesions, and what that'll feel like is you'll feel resistance. You can actually feel like it's pulling against your skin, but not moving against the skin, because I have it tight on there. It's like helping the skin move over top of the fascia and the muscles. So you do again like 10 to 20 flexion extension, go through some supination pronation. You could get this thing on here for about a minute, not much longer, because what'll happen is you'll start to see your hand lose color because you're affecting circulation and blood flow. And you're doing that on purpose, because when you interrupt the blood flow, what you're doing is you're helping, once you take this off, it's gonna reperfuse or like crash in brand new blood to help hyper kind of saturate the area, create hyperemia. So you're gonna have an increase of blood flow suddenly. You'll feel warmth come back. Your arm won't feel tired after you've had that on for a moment. You take it off, and you can actually feel like the warmth from the blood restoring back in the area. One of the hard parts with an elbow injury is that it doesn't always get enough blood supply to these little areas around the elbow itself where the muscles attach. So what you're gonna need to do is get more blood in. The cupper helps with that. This muscle floss helps with that. And the third and final tip or trick is also gonna help. Usually I wrap this up, but that feels like more fun. I'm just gonna toss the band because I couldn't toss the cupper. All right. This is just ultrasound gel. It's nothing fancy. We like using ultrasound gel. Sidekick is a great company for muscle scraping tools. We've used tools for the past 15 years in our clinic personally, and the original tools cost thousands of dollars. You can get these for between like, don't quote me exactly, but like around $60 to like $130, $140, depending on if it's steel or a different material. We made a video about that as well. We'll link that in, and we'll have a link for you to be able to purchase these. We've really done our homework on this. We use these an insane number of hours in a week, in a year. It's kind of absurd how much we use this. So I promise you we've really vetted it. But if you have some suggestions, put it in the link, or sorry, put it in the comments, and we can always take in some feedback of other tools you've used. So I use ultrasound gel. Sidekick gives you a gel, but I like the ultrasound gel because it's not messy and it gets the job done. And then you don't have to spend a lot of time cleaning. So you put some ultrasound gel on there, or whatever gel you might have. And then literally you're gonna scrape through this area, right? You wanna cover all of it. So I'm not just gonna cover the side of my arm here, or the back of my arm at my tricep. I'm also gonna cover my forearm, into my bicep, and I'm really gonna scrape through. And what that feels like is like gravelly, bumpy. Again, we'll put a video for that because these techniques we've really covered. So I don't wanna get too in the weeds on the technique. You can watch the video on the technique for each of these instruments or tools, but you can feel this like gravelly, bumpy kind of feeling, especially those of you who have this injury, because you're gonna feel with the steel instrument, you will feel yourself breaking those adhesions up. Promise you, 100% promise you. So the bigger benefit comes from if you can start adding some movement, so really kind of pulsing. Say I wanna get into my tricep, I'm gonna really pulse into extension while I'm scraping over top of the attachment of the tricep into my olecranon process here, or my elbow. So really kind of go through motion, pronate, supinate, same idea, really try to move. Spend in total maybe 2 to 4 minutes, depending on the size of your arm and your tolerance. But you want to spend at least a couple minutes really working through this, so that way, again, you can break up adhesions, increase circulation and blood flow, and help the fibers to realign more properly, which will help you to get your flexibility back, your mobility back. You'll also feel your strength come back because the pain will decrease. If you use these different instruments, 5 to 10 minutes a day, working on improving the range of motion, and not just strength training, you need to strength train. That's extremely important. You will need strength, but if you don't have range of motion, it's not because you're too weak to extend your elbow. The reason why you don't have range of motion is because it's too tight. There are too many adhesions. There's too much restriction. You need to address the tightness first if you want to improve your strength. So improve the mobility, improve the flexibility. You will be able to improve your strength and your pain, and you'll be able to then get a good lockout position again, whether you're a weightlifter, jiu-jitsu athlete, whatever it is you might do. If you have any questions, put them in the comments. Ask as many as you might have. We can help you through this. If you have other suggestions, things you're battling with that you want help with, feel free to ask below. If you want some one-on-one time, we do virtual visits or virtual consults. We'll have the link for that below, as well as all of the links for all of these devices I'm using. I appreciate you watching, and I look forward to hearing how these techniques have helped you. I'm Doc John from Mobility Doc. Thanks for watching.